Manic episodes are one of the defining features of bipolar disorder, and this refers to abnormally persistently elevated or irritable mood that lasts about 1 week or at least 1 week. For a hypomanic episode, this elevated state lasts for at least 4 days. And typically, three of the symptoms listed are present during this elevated time. And this could include inflated sense of self esteem, um, elevated risk taking behavior, increase in goal directed behavior, decreased need for sleep, being more talkative than usual, and flight of ideas. You can see how these symptoms could have a negative impact both on one's mental health as well as one's physical health, particularly if someone is taking parts in risk taking behaviors that can have some long term consequences as well. When thinking of treatments for mood disorders, cognitive therapy has been shown to be effective. This might take place within 16 to 20 sessions over a 12 to 16-week time frame and involves often both cognitive as well as some behavioral strategies. Patients often receive assistance in being able to engage in activities that once gave them pleasure. And then cognitive strategies help patients recognize some of their negative beliefs and work through that. Behavior therapy focuses more so on an increase of frequency in which one engages in pleasurable activities. And then cognitive behavioral therapy um, within treatment of bipolar disorder will teach patients that mood swings are a function of negative behavior and negative thought patterns, and these patterns are targeted and worked through in therapy. There are other forms of therapy that have been shown to be effective, which are listed as well, such as problem solving therapy. Medication is also an important part of treatment for some individuals with a mood disorder. There are medications that might be used to treat bipolar disorder as well as depression, the different forms of depression. Electroconvulsive therapy has also been shown to be an effective form of treatment. Now we move our conversation to talk a little bit about anxiety disorders. Anxiety disorders include a host of disorders such as panic disorder, obsessive compulsive disorder, post traumatic stress disorder, generalized anxiety disorder, and a variety of phobias. The reading under course documents for this topic does have some information about certain anxiety disorders. So take a moment to make sure that you look through that so that you could gain a deeper understanding of this area. Each year, there are about 18% of adults within the population who have a diagnosable anxiety disorder. This often co occurs with depressive disorders or with substance abuse. The age of onset is age 21. However, anxiety disorders are also diagnosed in children as well as in adolescents. It's difficult sometimes to establish the limits between normal behavior and pathology. In response to stressful events, we might experience mild, brief anxiety. However, anxiety becomes symptomatic and problematic when it limits or prevents developmentally appropriate adaptive behavior. Obsessive compulsive disorder occurs in approximately 1% of the American population. The average age of onset is 19. However, symptoms often occur in childhood. OCD, or obsessive compulsive disorder, has a number of defining features, which includes recurrent obsessive thoughts or repetitive behaviors, also could be known as compulsions, that the person feels they must perform. An obsession could include, but are not limited to, areas such as germs, violence, or social embarrassment. And some people may engage in elaborate rituals surrounding cleaning or checking routines. For example, counting or touching things in a sequence. Obsessions or compulsions cause significant distress for the individual who is experiencing it, and they can be time consuming. For a diagnosis of OCD, these obsessions or compulsions must take up more than 1 hour out of a person's day or interferes with someone's normal routines and their functioning significantly. People with OCD tend to recognize that their obsession or compulsions are unreasonable. About 3% of American adults per year have a diagnosis of general anxiety disorder. The median age of onset is 31. Similar to other mental health disorders, although they give the average age of onset, the disorder can certainly occur earlier in one's lifespan. Some defining features of generalized anxiety disorder include a pattern of excessive worry most days for 6 months. And the worry that the person is experiencing is very difficult to get under control. The worry is associated with three or more of the following: fatigue, reduced concentration, difficulty falling asleep, irritability, restlessness, and muscle tension. Anxiety can be treated through both psychotherapy and medication. Through psychotherapy, there might be education as well as skill building, along with exposure exercises. And medications could include antidepressants or anti anxiety drugs. A combination of both therapy and medication may be the best course of action, but certainly that's a personal decision that someone makes with their doctor. Now we move on to schizophrenia. Schizophrenia impacts about 1% of the American adult population. It affects men and women a little differently, but certainly um, men and women are both diagnosed with schizophrenia. Schizophrenia includes both positive symptoms as well as negative symptoms. Positive symptoms might include delusions, which are false beliefs that are strongly held in spite of invalidating evidence. Hallucinations, which can refer to visual, auditory, tactile, that means by touch, olfactory, which means the smell, or hallucinations associated with taste. Positive symptoms can also include disorganized speech, as well as disorganized or catatonic behavior. Negative symptoms associated with schizophrenia include things such as lack of emotion, Social isolation, having flat affects, which refers to like a blank facial expression or flat tone of voice, difficulty or an inability to speak, low energy, and inappropriate social skills. In addition to the positive and the negative symptoms, there are also some important cognitive symptoms. And this could include things such as slow thinking, having difficulty putting one's thoughts together and integrating thoughts, difficulty expressing thoughts, poor concentration and memory, as well as difficulty understanding. In order to receive a diagnosis of schizophrenia, there needs to be a combination of two or more positive, negative, and or cognitive symptoms for a significant portion of 1 month. And in addition, one or more areas of functioning in one's life is significantly below levels um, that one experienced before the onset of these symptoms. And, there needs to be continuous signs of this illness present for a minimum of 6 months. There are a few risk factors to be considered associated with a diagnosis of schizophrenia. These include the use of substances, um, damage to the frontal or the temporal lobes of the brain, and if parents or siblings had a diagnosis of schizophrenia, that increases someone's risk of also being diagnosed with that illness. Treatment for schizophrenia is very, very important. It can include cognitive behavioral therapy, which might last 6 to 9 months, to target those dysfunctional thoughts and behaviors. It might include cognitive remediation therapy to teach people thinking skills and to target specific domains that are impacted by schizophrenia. It might include social skills training. There might be family therapy to focus on educating and teaching effective communication and problem solving. And medication might be a very important part of treatment for someone with a diagnosis of schizophrenia.